Kirk is a member of my team in West EOC. He is a very proficient emergency medical advisor and has been with the Trust for 3 years. Kirk had returned from being off duty for a considerable time, and the very first call that he undertook within the West EOC was a lady in Chichester who had just given birth. She already had a 12-month-old child in the house, and the baby was born query breathing. Kirk immediately went into the process of providing CPR, and the clinician within the room, Emma Sullivan, went to his side to give him any further advice and support. During this time, the baby did start breathing again, much to the relief to everybody. But unfortunately, the baby then arrested a further second time, by which time the excellent crew were on scene, scooped and ran to St Richard's Hospital, to which I found out later that afternoon mother and baby were doing fine, sitting up in bed, and all was well. The most poignant thing about this incident is that Kirk had returned from being off duty, and the reason he had returned from being off duty and been off duty in the first place was the fact that Kirk's partner, Charlotte, had just given birth to a baby boy called Daniel. Daniel was also a few weeks premature, but with regret and sadness, Daniel passed away in Kirk's arms after being born after 2 hours. To take the very first call on your return to duty and having that type of call, knowing what he's been through, knowing the circumstances of what has happened, has been absolutely amazing. He was proficient, diligent, and took the call so calmly, smoothly, thinking about the patient at all times, and above all, the patient's mum at all times. Out of all the calls he could have had a little old lady who's fallen and broken her arm, or somebody who's got abdo pain. That was the worst call, but the best call. It gave him the impetus to carry on instead of wallowing, and he himself realised at the end of that call, I'm doing a bloody good job here, and he is doing a bloody good job.